Good afternoon. I'm Julie Murray. I'm the Chief Officer of the Health and Social Care Partnership, and I'm here to give you an important update on our Fit for the Future redesign programme. As you will know, over the last few years we've had unprecedented savings to make, and at the same time demand for our services has grown. We have lots of older people in East Renfrewshire, which is a wonderful thing, but big pressures on our services. We've also got older people moving into the area to stay in some of the care homes that have opened. We have pressure on our children's services because people do love to come into East Renfrewshire for schools and for family life. And that's great, but we've had a lot of difficulty trying to kind of keep doing the same things the same way with more pressure in terms of more activity but less finance. So it's time to be even more radical in thinking about how we deliver services and how we support people. The Fit for the Future programme has been quite ambitious in its aim to deliver about £1.7 million worth of savings for us for 17-18. And we've initially focused on older people's and adult services. As you will recall, we had a kind of fairly significant review of children's services last year and restructured more recently. We've secured quite a bit of the savings that we've had to find for 17-18, but we still have over £900,000 to achieve from the review and redesign work. So the service reviews are actually still ongoing, but through time spent with staff, capturing processes and collecting feedback, I think we've identified that there are some significant opportunities to make some savings. There are quite inconsistent processes across teams in the HSCP, meaning that people have different customer experience when they come to different teams. We're also spending quite a lot of time on administration, including professional administration. We have a number of very small teams which are perhaps not sustainable going forward. We think we can build on what we've learned from the talking points tests or pilots as part of community-led support to really inform a new way of working that reduces demand on our services. We think we could look at IT and have staff having better kit. And we really think there's an opportunity to take out bureaucracy to improve and streamline process. Started a few tests of change. There's quite a few people trying a digital dictation pilot, which actually should cut out a lot of time spent in professional administration, and we're also testing tablets with a range of groups. Alongside this redesign, we've been looking at the structure of the Health and Social Care Partnership. And there have been some principles that have underpinned our review of the structure. And so these principles are that the structure needs to support our strategic priorities, it needs to deliver the required savings, it needs to enable stronger integration, it needs to look at embedding capacity in operational services, so that's planning capacity, data analytics capacity. It needs to ensure that we have a principle of general management, but supported by very strong professional leadership, and that's across social work, nursing, allied health professionals. Our approach to savings starts at the very top of the organisation. So what I'm here to tell you today is that we're about to change the structure of the heads of service. We have had the same configuration in place since 2006, and more recently in 2015 we took on a Chief Finance Officer as the legislation changed. So we've reviewed the heads of service roles to ensure a sharper focus on strategic priorities, and we think we can achieve some efficiencies. Frank White, who's the Head of Health and Community Care, has chosen to leave the Health and Social Care Partnership. So moving forward, we will have 3 heads of service. Kate Rocks, who is Head of Children's Services and Head of Public Protection, who's our Chief Social Work Officer. Candy Millard is going to be Head of Locality Health and Social Care, which will focus on older people's services, long-term conditions, work with GPs, the whole unscheduled care agenda. And Leslie Bairden, who is currently our Chief Finance Officer, is going to take on a bigger role. She's going to be Head of Finance and Resources, but will remain our Chief Finance Officer. A further change will be that recovery services, and by that I mean adult mental health and addiction services will be managed by a senior manager reporting directly to myself. So, as I said before, we're going to try and embed strategic services in the operational arms, but we will continue to have some sort of corporate centre which Leslie will manage around performance and planning. So there's still quite a lot of work to do going forward, and we'll have to do it in quite a sharp pace, because we need to try and deliver the programme for implementation at the beginning of the next financial year. So there's work to do to firm up on the management structure below head of service level, and we're going to have some sessions in January with a cross-section of staff to do some work on that and make sure that we are designed around the right care pathways for people. This is particularly in locality adult health and social care. That's going to inform the structure we need below head of service level. This can be an unsettling time for staff because some people don't like change, some people thrive on change, but we need to change. The status quo is not an option, so what we need to do is make sure that we make savings in a humane and intelligent way, and I think this programme is going to help us do that. But if you do have any questions, please contact a manager or myself directly. We will be holding staff engagement events in January to try and talk to people a bit more about this, and we'll be able to answer questions then. The sessions are on the 15th at Barrhead Health and Care Centre and the 19th here at Eastwood. So just keep looking at your emails or announcements around the timings of these sessions. So I hope that's been helpful. As I say, we will keep in touch with you, we'll keep you informed, we'll have these staff engagement sessions, and we're very keen to hear your own ideas. So if you've got any questions, as I say, please talk to your manager or you can drop me an email directly.